Your doctor handed you Xanax for your anxiety, but 3 months later, you find out it's not working as well as it was initially. If anything, you're even more anxious. Here's what's really happening and why that little pill might be making everything worse. Today, I'm breaking down the truth about Xanax and menopause anxiety. I'll show you why your brain responds differently to this medication after 40. I'll reveal the rebound effect that traps so many women, and I'll share what actually works for better long-term relief. Stick around because what I share at the end could change everything for you. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle medicine physician. Let me tell you about Alexis. She's 48, started having severe anxiety and panic attacks out of nowhere during perimenopause. Her doctor prescribed Xanax. It worked fast. Within 20 minutes, her heart racing slowed, her mind quieted. Initially, she only needed it sporadically. Then slowly, she began taking it every single day, then twice a day. And the anxiety between doses worse than before she ever started. Alexis isn't alone, and this isn't her fault. It's how Xanax works in your brain. Xanax alprazolam is a benzodiazepine. It works by boosting GABA, your brain's calming neurotransmitter. Think of GABA like the brakes in a car. When anxiety is high, it's like your accelerator is stuck. Xanax slams on the brakes, fast relief, immediate calm. But here's the problem. Your brain adapts fast. Within a few weeks, your brain adapts by making less GABA and reducing the sensitivity of GABA receptors. It expects the pill to do the work. This is called tolerance, and it happens faster with Xanax than almost any other psychiatric medication. Now, you need more to feel the same effect, and when it wears off, your anxiety spikes higher than before. Here's what most doctors miss. During perimenopause, your estrogen and progesterone levels drop. These hormones naturally regulate GABA, the same brain chemical that Xanax affects. Emerging research suggests that menopausal women can experience changes in GABA receptor function, which may affect their sensitivity to benzodiazepines. Translation: your brain is already struggling to calm itself. Xanax creates a temporary fix, but it weakens your natural system. If you find this helpful, consider subscribing to this channel so you don't miss future content on managing anxiety during menopause. This is the trap. Between doses, your anxiety isn't just back, it's worse. This is called rebound anxiety. Your brain has adapted to the drug. When the drug level drops, your brain can't calm itself anymore. You feel jittery, irritable, panicky, so you take another pill. And the cycle continues. One study found that women who used benzodiazepines for more than 8 weeks had significantly higher rates of depression and cognitive issues compared to those using non-medication approaches. Memory problems, brain fog, increased fall risk, and for some women, Xanax actually increases irritability and anxiety, the opposite of what it's supposed to do. I'm not anti-medication. There are times when Xanax can help. For occasional use during acute anxiety episodes, for short-term relief during a crisis lasting about 2 to 3 weeks, for specific phobias such as a fear of flying. But for chronic daily anxiety during perimenopause, the research is clear. Long-term benzodiazepine use creates more problems than it solves. Here's the truth. Your anxiety isn't just a brain chemical problem. It's a hormone problem, an inflammation problem, a mitochondrial problem, an insulin resistance problem, a gut problem. What this means is that to treat anxiety adequately, you need to address it from a root cause approach. If you want to learn more about natural anxiety solutions during perimenopause, watch the next video on 5 natural supplements for anxiety in women over 40. You've likely never heard of the 5th one.